Panel 4 is how do family ties affect retirement security? And again, we have 3 papers, 15 minutes per talk and 10-minute discussion. And the first paper is Financial Well-Being in Late Life, Understanding the Impact of Adverse Health Shocks and Spousal Deaths. And the presenter will be James Poterba from MIT, and the discussant will be Christopher Tabarini from SSA.
I would just like to start by using a little bit of my precious time to put on my NBER hat and thank the Social Security Administration as well as our colleagues at Michigan and at Boston College for bringing together this terrific meeting, particularly to SSA for its long-lasting support for the RRC endeavor. Periodically in my NBER role, folks from foundations or other places come and ask, how can we help to shift the focus of research in a particular direction? And we'd like to get people working on such and such a topic. And invariably what I say is the key to making this work is not doing a very short-term project, but actually being there with a commitment for a long term, because the way you get really talented researchers to work on a particular area is by convincing them that there's going to be a community that's going to be focused on that topic, that they're going to have other interesting people to talk to and to critique their work and to help advance the field. And just as John said, the topics that we tackle here within the scope of the RRC are clearly incredibly important for the US and for the global economy as we see demographic changes and think about the role of retirement security. But one of the things that's been really special about the RRC initiative is that it's enabled the 3 recipient institutions to pull together a really terrific team of researchers and to convene them year upon year and help that research build upon itself so that people not only can do their own work but also connect up with the research of others. So I am incredibly grateful to the SSA community for supporting this set of research projects and just wanted to say thank you on behalf of the research community. So we'll just stop and have a quick round of applause. Okay. Having said that, the work that I'd like to share with you today, which is work with Steve Venti at Dartmouth, very much is in the model of drawing upon some of the other work which has been done over the years by RRC-related researchers and talked about at these meetings. We have particularly been interested, along with our colleague David Wise, in understanding some of the issues around the very late life financial status of individuals and of couples, and understanding how it is that a non-trivial fraction of individuals come to the year or two just before death with very low levels of financial assets. And we've been able to find that much of that group reached retirement with very low levels of financial assets. So the issue to understand is not so much what happened during retirement, but rather what happened during the work life, which brought them to the moment of retirement with very low levels of assets. Nonetheless, there are some who seem to have reached the point of retirement with a pool of assets that, absent various shocks, might have looked sufficient to bring them through the remaining course of their life. Yet when we see them at the end of the life, they seem to have run down to a very low level of particularly financial assets, but also of net worth. And the question, of course, is how did that come to be? Is it that they spent a lot? Is it they faced unexpected shocks or low probability shocks which materialized for them? And if so, what types of shocks would those be? And not surprisingly, thinking about those shocks leads to thinking about health shocks or family status shocks like the premature loss of a spouse, and understanding how those shocks translate into financial consequences for the households. This work, for example, is closely related to the work that we saw this morning from the McInerney and Rutledge and King team, which was basically focused on understanding how out-of-pocket medical expenses connect up with the level of Social Security benefits. We're rather taking a stocks rather than flows approach and looking at how the household balance sheet is evolving in response to various shocks of the kind that might come along. I want to emphasize at the beginning, as one of the earlier presenters did, that there are lots of endogenous variables here, and our paper very much is studying in a descriptive way what happens to households as they face these shocks, and the next stage is to try to think hard about some of the challenges around identification, but you'll see in a minute that we're not quite there just yet. Okay, so what we are basically going to do is we're going to focus on the changes in wealth that households or individuals report in the health and retirement study as they go through their retirement years. This is a 65-plus population in the HRS, looking at the waves at the waves beginning in 1994, finishing in 2010, and basically asking the question, what sort of wealth changes do we see around the new diagnosis of a health circumstance or around a health event like an entry into the hospital, an entry into a nursing home, or the death of a spouse. And we're going to try to cover some terrain which has been looked at in the past by trying to measure these kind of wealth costs of these various events. Now, wealth cost in this context is going to be the change in wealth that we observe around these events. One of the reasons we have historically liked using this delta wealth measure to capture this, as opposed to, say, an out-of-pocket medical expenses measure as directly reported, is on the grounds that some of the costs of these shocks may not be just medical bills, right? If you need to retrofit your home to handle something like a new disability, that may not show up in a bill to a doctor or a hospital, but nonetheless is a health-related cost. So this is a somewhat broader measure of what's there. The other thing we can do, of course, by focusing on the household balance sheet change is to see if we can net out whatever insurance covered that may be hard to track down. The challenge with this measure is that wealth is the difference, the change in wealth is the change between 2 points, and it is related to the rate of return on wealth that you held, the income that you had, which of course is Social Security benefits and other things that might be coming along, the expenditures you may have related to this health shock, as well as your consumption expenditures, right? So the key equation here, the budget equation, basically linking up wealth at time t plus 1 and wealth at time t minus 1 with the other things that happen at time period t, reminds you that we are essentially looking at changes in something like M, the medical costs, and then seeing how that maps into changes in W from one period to the next. So that might or might not be a completely useful measure of what the health shock leads to. In particular, there might be changes in consumption or transfers that would show up in consumption that may be linked to the health event and that might not be really, quote, health-related shocks. I'll give you 2 examples, right? In the event that you get bad news and you're a high net worth household, you're trying to do some estate planning, you might start doing transfers to your kids, which would show up in a different way in your wealth after the health shock than before, but they in some sense are not costs related to health. Okay. Similarly, you discover you have arthritis, you no longer can play golf, you stop spending money on your golf club, that actually changes your consumption outlay in a way which is correlated with the health shock, but whether you want to call that exactly a health-related expense is probably a bit of a stretch. So I want to be clear in terms of this complicated measurement issue. There's also the problem of measurement error in wealth, which we know is a challenge in data sets like the HRS. Leaving that all aside, though, if the question is, can we explain how somebody gets near to the end of life with very low levels of wealth, given where they started, the question of what wealth changes do we see along the path and how do they correlate with whatever these health shocks are is at least, I think, a helpful way of trying to understand the process which leads households to a particular outcome. Okay, so what do? We basically try to identify a set of health shocks that households or individuals may face. We're measuring wealth at the household level. So whether someone is single or an individual, we're going to try to aggregate the health shocks for married couples. So when we say the household experienced a stroke, if it's a married couple, that could be a stroke for either member of the couple. If it's an individual, of course, it's just that person. And we look at the probabilities of various kinds of shocks. So this is, for example, just for individuals. For men, say, the probability of a stroke, which is one of the events that we focus on, this is a little bit less than 1% a year in your 60s, rising to something over 2% by the time you're in your early 80s. For women, the pattern is similar in terms of structure, a little bit lower in terms of level. But the idea here is that we are going to look, and this is, by the way, the first stroke. So this is the first time one of these diagnoses occurs. We're going to basically be focusing on what the nature of these shocks are and what these probabilities look like over time. Okay. We also look at the lifetime probability of these various shocks. So this is for men and for women. Stroke, for example, the probability is in the low 20s of having this episode. Heart attack, a little bit lower. I'm going to focus your attention also on some of the common ailments like hypertension and arthritis, which are something that happens to nearly half the population. These, of course, also may be lower cost events in terms of the nature of what's there. So we're going to try to focus on measuring the costs of these different kinds of shocks over the time periods when they happen. Okay. What we're then going to do, and we're going to put this, as I said, together, is to look at the couples. This is the annual probability in the HRS of the respondents in this over 65 group experiencing one of these shocks in their households. For stroke, it's on the order of about 3.8% per year, lung disease about 3%, arthritis and hypertension close to 1 in 6 rather. These, by the way, are 2-year windows. This is, those of you who've worked with the HRS, this is between waves of the HRS, so you can have these numbers to get the annual probabilities. That gets you back to something like the figure I showed you a couple of minutes ago in terms of understanding what this all looks like. All right, so then what we're going to do is to say, let's look before and after one of these shocks, one of these developments, and see what does this translate to in terms of what we would call the wealth cost. Okay? And the wealth cost, this is really the critical table to look at, the wealth cost of a new diagnosis. And if you look at the stroke at the top, for example, this is saying that for the entire HRS group, that in a 2-year window, when a stroke is first reported for one of the members of the household, or the individual if it's a one-person household, right, the average decline in wealth is about $25,000 between the wave before and the wave of. Okay? And the numbers that are bold here, so that's lung disease, stroke, and then the 3 at the bottom, hospitalization, nursing home stay, and death of a spouse, those are the statistically significant effects that we find. So for a number of these, you just don't find very much in terms of the wealth change, at least given the sample sizes we have available. That may reflect, of course, the fact that much of the expense associated with these things is insured. And one can view this project in some ways as a test of how tight is the social safety net, the Medicare and other insurance that folks have, in terms of covering the kinds of costs that arise here. Okay? One of the things that Steve and I discovered only earlier this week, and when you send the discussant something on the day before the presentation, you just open yourself up for the comment about, in the results we were sent yesterday. But we decided this was interesting enough that it was worth taking that risk. So Chris, you've got your free shot here. Okay. One thing that we did not do in the slide or in the paper, but did more recently, was to stratify by wealth level. Because of course you're all probably thinking, if you've got very little wealth to start with, how could you have this drawn down by very much? Of course, textbook answer, you could, because you could end up with debt instead of positive wealth. But in fact, what you have, if you group the households into roughly thirds, so that you've got sort of an under $50,000 net worth, 50 to say 500, and over 500. Okay, the numbers on say stroke, under 50 minus $4,000, statistically insignificantly different from 0. 50 to 500 minus $24,000, statistically significantly different from 0. More than 500,000 minus $60,000, very clearly statistically significantly different from 0. Okay, look down to the lower rows where you see nursing home stay. The average is minus 14. Okay, minus under $50,000, minus $4,000, statistically insignificantly different from 0. 50 to 500, minus $34,000, very significant. 500 plus, minus $68,000, statistically significant, right? So the pattern that emerges here is once you start to look at the group that's actually got wealth to begin with, these health shocks, the ones that look like they're important here, actually become more costly as you go up in terms of the foregone wealth. And I think that's telling us something which I'm sure, if we think about our own families and relatives, those who have resources can find ways to spend more around these kind of shocks. But it is actually informative, I think, for trying to understand how we can get somebody from a position of having, non-trivial resources at the start of the retirement period to much less later on in the period. So we think of this as providing, some evidence, and I want to be, very clear to note that there are a lot of non-bolded numbers on this chart, right, which are statistically insignificantly different from 0, and I don't want to pay too much attention just to the diagnoses which are significant. I think it is important that at the bottom, the health events that are the hospitalization, nursing home stay, and in particular death of a spouse, those are quite clearly statistically significant in large parts of the population, suggesting that those events, as the title of our session suggests on family linkages, can in fact be very important. Okay. With this providing some evidence that these shocks may be of consequence, the next thing we try to do, and the last thing, is just to say, how can we look at the lifetime cost of this from the perspective of someone, say, at age 65? Okay, and I want to say two things about that. First, we know from the work that others on the panel, Eric in particular, have done, that the distribution of health expenditures, the out-of-pocket measures, is very, very dispersed. and that a lot of the concentration is in the upper tail of that distribution. So the top 10%, the top 5% is where the big dollar outlays are. So looking just at the averages may not in some sense be the most informative thing here from the standpoint either of precautionary saving or understanding what the potential risks are that folks face. Nonetheless, from the standpoint of asking just how much wealth on average would one expect to see used up with these kind of changes, right? That's something where looking at the averages may be of some information. Okay, so we do a calculation which basically says let's look at the expected cost, where we take the probability of each of these events over the time of remaining lifetime, multiplied by the survival probability. You have to get to age 80 to be able to have the risk of the stroke at age 80. And we multiply that by the cost of the stroke that we find, and we discount that back at 2.5% real, generous rate of return, to try to figure out what these numbers look like. Okay, what do we find, say for stroke? Okay, well, remember, stroke was something which seemed to cost on average $25,000 in our sample. Probabilities were on the order of 1 in 6 that you might face this. There's some discounting here, so the numbers not surprisingly give you for the averages something on the order of $6,000 or $7,000, and we've broken this out by various groups. Okay, what we ultimately conclude is that these costs of unexpected shocks, right? These changes in wealth, on average, look like they are on the average between $30,000 and $70,000 for households. Remembering that that's not the tail probabilities, and those could be much, much greater, okay? But these as a share of wealth that people have, particularly for low wealth households, look like they are quite substantial at the start of retirement. So I think that this is a project where you might come away and say, is the glass half full or half empty? It's clear these are important costs for some part of the population, and they loom large relative to some of their wealth accumulations. On the other hand, for those who are in the upper part of the distribution, understanding how these larger numbers emerge and whether that's more discretionary in terms of what's going on is something I think we need to look at going forward. Okay, thank you very much.